It's been about 18 years since I'm a paramedics, and the working conditions just is getting worse and worse and worse. And we really got to do a big cleaning and update the condition to have a winning solution.
Paramedics across Quebec are tired and overworked, many forced to do overtime with little to no breaks, they say. Those under the Federation of Pre-Hospital Employees of Quebec, which accounts for 40 ambulance services in the province, are on strike, asking for better pay and better working conditions.
The work conditions are really getting worse and worse, and it's a vicious cycle that we need to break right now, because we want to have some paramedics take care of our elderly. And if we don't react soon enough, well, I don't know where we'll be in a couple of years.
The strike will not impact the level of care to patients, as the service is essential, but paramedics will stop doing certain administrative tasks.
There's a big problem with the government. They don't want to put money to actualize the system. We're kind of like 30 years backwards, so we really need to actualize the system, give the paramedic a proper salary, proper work condition.
On average, paramedics in Quebec are paid the lowest across Canada, with a starting salary at roughly $23 an hour.
The healthcare budget's in the tens of billions of dollars, and there are only about 7,500 paramedics in Quebec. So you could come to an agreement, pay them their proper worth, treat them properly, show them respect and appreciation, and still not make a dent in the overall health budget.
The Quebec government put together a committee that has provided recommendations to better the working conditions of paramedics and their services, none of which have been implemented. The union represents 2,500 pre-hospital service workers, including paramedics, and have been in negotiations with the provincial government. Gagne says he has been working without a contract since March.
The pandemic's ongoing, and so we're completely dependent on on paramedics and on emergency medical dispatchers, on the support staff. They're our true front line. So why marginalize them? Why not celebrate them? I just don't get it.
For Gagne, he says those taking part in the strike will stand their ground. If they don't, he doesn't see how the industry will keep going.
If nothing's happened, they don't go forward with the money to actualize the system, well, I told you, I think the system will crumble over on itself like a black hole. So if we don't do nothing, someone will pay. Is it the worker? Is it the patient? I guess the patient will pay the price.
In Montreal, Felisha Adam, City News.